So next dislocation that can occur, which is not uncommon, is acromioclavicular dislocation. If the dislocation is not complete, we call it as subluxation. I'll give a small example diagrammatically. What is the difference between subluxation and a dislocation? In a ball and socket joint, it is more obvious than in other dislocations. If you take a ball and socket joint, like as for example, there is a SW. If this head completely comes out, SW being like this, and head somewhere here completely away from the acetabulum, we call it as dislocation. That is total loss of articulation between two articular surfaces. It is known as dislocation. Suppose if it is partial, this head comes out partially, and you can see the head here like this. This, because the acetabulum here, the still part of the head is inside. This we call it as subluxation. Why this is very important is sometimes little bit of subluxation in some of the joints you might miss unless you have an idea about the difference between a subluxation and a dislocation. So why I am particularly mentioning at this juncture is the acromioclavicular joint, you can see this is the clavicle and this is the acromion. Here the joint gets dislocated. Once this gets dislocated, the clavicle will push up. So that is the clavicle as seen as like this and the acromion process like this. So it looks like a big knob or a projection because the clavicle is completely come out of this area and sitting here. So sometimes it does not happen like that. The outer end of the clavicle partially comes out from the acromion. So here if it partially comes out, it is only a subluxation. Whereas completely it goes out, then we call it as a dislocation. Or sometimes people may grade subluxation and stuff that, people may grade it as 1, 2, 3 and all that. One more thing that occurs, suppose this is the clavicle and this is the acromioclavicular joint. So here sometimes the fracture is so close to the clavicle, entire thing moves up. At that time what happens, as if looks like a dislocation, but actually there is no dislocation, but this clavicle along with original acromion is normal. Original acromion is normal, acromioclavicular joint is seen, but the outer end of the clavicle will be pushed upwards or sidewards. So here you have got to be very careful to make out the difference between just a dislocation at the acromioclavicular joint and a fracture with displacement near the outer end of the clavicle. Both look alike sometimes, unless you are very careful, sometimes you may mix up one for the other. What are the signs and symptoms of a acromioclavicular joint dislocation? First is fall in an outstretched hand, following by severe pain in the shoulder and disability or inability to lift the shoulder. Patient will have a lot of pain while lifting, abducting the shoulder. As long as they are keeping it here, the pain is not much. The minute they try to move the shoulder, then they have the problem. Here because the articulation and the ligaments that are there, the acromioclavicular ligament, they are all torn and that's why they will have difficulty. And then you have got to confirm it by taking X-ray, and after confirming it, the treatment for acromioclavicular joint. It all depends upon how early the patient comes to us. Usually the patient will think that there is no fracture because people can't make out the dislocation except for the prominence of the outer end of the clavicle will be prominent, there won't be much else. So even if they take the X-ray, people may not be in a position to understand the dislocation of the clavicle and they leave it alone. They come to us very late. But fortunately, once again here also, except for the cosmetic purpose, that is the prominence of the outer end of the clavicle, you won't have much of a disability after some time. And especially in elderly patient, we can jolly well leave it alone instead of meddling with it. But the patient is seen early. There are two ways of treatment. One is conservative treatment. In conservative treatment, common thing that is done is, it's very difficult to keep it in position, but still to a large extent this Jones's strapping is done to reduce the thing and keep it intact at least for 3 to 4 weeks. Very often it's very difficult to keep this strapping and people remove it and come to us within a few days with a projection of the outer end of the clavicle. mostly nearly 80 to 90% of the people it will be a failure.